Hello everyone, I'm Daniel Steele and I'm coming to you from the traditional, ancestral, and unceded territory of the Musqueam people here at UBC campus. This lecture is on immunization ethics and it will cover the Navin and Atwell reading from week 10 of the syllabus in SPPH 538. So let's start with the main idea of the Navin and Atwell article. So this is expressed in a passage in the introduction of their piece, and they say the following. They say, general claims about the importance of public health, proposed trade-offs between public health and liberty, or arguments by analogy to other kinds of justified state coercion are insufficient to provide ethical justification for vaccine mandates. This is because these kinds of arguments presume both too constrained a conception of the values that vaccine mandates implicate and too general a conception of vaccine mandates. So you might read this and not be quite sure what they're trying to say to you. So let's try to tease out the two main ideas here. So Navin and Atwell are criticizing other ethicists who've written about vaccine mandates on two grounds. The first is they think that a lot of these other ethics works on vaccine mandates have focused almost exclusively on population health and individual freedom as sort of the only relevant ethical values in these examples. And so their point is that, well, of course, population health and individual freedom are important. They're not the only ethical issues that are at stake and at play when it comes to vaccine mandates. So equity, human rights, a number of other things that we'll talk about are also relevant. Secondly, they argue that many ethics discussions of vaccine mandates have failed to pay sufficient attention to how the details of the vaccine mandates and the context in which those mandates are implemented matter for ethics. And so here the idea is that vaccine mandates aren't just one thing. There are many different types of policy, and they're policies that can be implemented in very different contexts. And so the details of the mandate itself and of the context in which it's being implemented can really matter for the ethics of whether that mandate was justified or not. So let's dive into these ideas a bit more. Starting with what's a vaccine mandate? What does it mean to make vaccination mandatory? So we can define a mandatory vaccination as imposing some penalty or restriction on those who do not get vaccinated. Some mandatory vaccination mechanisms that are commonly used are vaccination as a condition for access to certain public services in North America, US, and Canada. This is most commonly public education. So most states in the US have vaccination requirements as a condition for enrolling in public schools. In Canada, there are two provinces, Ontario and New Brunswick, who have similar legislation. In addition, there can be legal penalties for those who do not get vaccinated, and these might be things like fines or some other type of penalty. Those are less common in North America, but you can find those in examples of those kinds of policies in other countries. And to be clear, when we're talking about mandatory vaccination, we're not talking about forced vaccination in the literal sense of just like forcibly grabbing people and injecting them with a vaccine. That's not the kind of policy that we have in mind. In addition, vaccination mandates usually allow for medical exemptions, and many also allow for non-medical exemptions. And the non-medical exemption is an example of the kind of details that can matter for how a vaccination mandate works and also matter for its ethics. Okay, so let's return then to the first point that Navin and Atwell were making, which was that there's more to the ethics of vaccine mandates than simply population health and freedom. So here's a list of some other ethical concerns, most of which are sort of mentioned in the reading by Navin and Atwell. So there's equity. It might be that a vaccine mandate affects different populations differently, and that can raise equity issues. Public trust is obviously a huge issue in relation to vaccine hesitancy, and something that was a major issue when it came to COVID-19 vaccinations and remains an important ethics issue regarding vaccine mandates to this day. And then human rights is another issue. So for example, the right to education seems like that's something that can be relevant to vaccine mandates that connect access to public schools to being vaccinated. Professional duties, such as the duty of healthcare workers to not, put their patients at risk, could also be another relevant ethical concern. And Navin and Atwell advocate in their article value pluralism, which is the idea that there's no single ethical value like utility that all these other values reduce to. And that way they're similar to some of the ethics frameworks we saw earlier in the term. So for instance, if you remember Childress and colleagues' ethics framework for public health, that was sort of pluralistic in a similar way, that you have a bunch of different values and these values need to be weighed in some qualitative sense, but there isn't any sort of single value that they can all be reduced to that would allow you to somehow compute what the total, ethical effect was of a policy. So in addition, Navin and Atwell argue that many discussions of the ethics of vaccines mandates have not paid enough attention to the ways that vaccine mandates can differ from one another and the ways those differences can matter for ethics. So they identify three different sort of ways that vaccine mandates can vary. They can vary in which vaccine should be required. So typically vaccine mandates do not require everybody get every vaccine, but it's specific vaccines. And of course, vaccines are related to diseases. So if you're thinking about which vaccine you're going to require, then it's going to be which diseases are most important to target and why. And that's going to depend on the context. And what should be done to vaccine refusers. So that's, what's the penalty? What's the thing that happens if you don't get vaccinated? Is it you're not allowed to enroll your kid in school? Is it that, you're not allowed to work in a particular place? What is this thing that happens? Is it you pay a fine or what is it? And then how should mandates be enforced or people exempted? Again, vaccine mandates typically have exemptions for medical reasons, and often will have non-medical exemptions. And so those kinds of details, if they have non-medical exemptions, how they work, etc., even how the medical exemptions can work, can be important for the ethics of the vaccine mandate. In addition to the question of who the mandate applies to, for example, children, healthcare workers, or maybe the general public, those can also be relevant. So the idea is there's a lot of different details about vaccines and vaccine mandates, and that these are relevant to the ethics. So let's think through these ideas in connection with some ethical approaches that someone could take to vaccine mandates, starting with utilitarianism. So you might have the impression that, utilitarianism would always be in favor of vaccine mandates, but that's not really true. It's going to depend. Utilitarianism is always going to think about what's the benefit? Does this policy produce more good than harm? What's the overall benefit and how efficient is it compared to other things we could spend our money on? And so whether a vaccine mandate is a good idea from a utilitarian standpoint is going to depend on a number of things. For example, what's the increase in vaccination rates that would result from the mandate? You might naively think that, if there's a mandate, everyone will get vaccinated. But in real life, that's not how it's going to work. What's really going to happen is that you have a certain rate of vaccination before the mandate and a presumably higher rate of vaccination after the mandate, but that higher rate's probably going to be less than 100%. So you want to know, how big is that increase? You'd also want to think about the severity and the infectiousness of the targeted disease. Obviously, the more severe, the more infectious the disease is, the more reason you would have to try to take measures to restrict the spread of that disease. Efficacy and risk of the adverse effects of the vaccine. Clearly, the more efficacious and safer the vaccine is, the more you're going to have a strong argument for a mandate from a utilitarian standpoint. The prevalence and incidence of the disease in the population. If the disease is really rare in the population and there's no outbreak of new cases or anything, then it's going to be hard to argue that you should have a mandate from a utilitarian standpoint. You probably could spend that money on something else that would do more good than the mandate for this disease that hardly anybody gets. And similarly, the prevalence of immunity to the disease, prior vaccination rates or prior exposure or whatever it is in the population, that's going to matter to how much benefit you get from increasing the vaccination rate. And again, can matter towards two questions about whether it's worth it. Social impacts of the mandate, such as public backlash and so on, could also be relevant. So in other words, it can be a complex consideration even from a utilitarian standpoint. If we think of some other ideas, such that are often raised in connection with vaccine mandates, the harm principle, for example, states that the government can restrict individual freedom only to prevent harm to others. And this is often cited as a reason for why vaccine mandates can be justified, because failure to be vaccinated can create harm to others. So for instance, children might be harmed by their parents' vaccine hesitancy, or people who can't be vaccinated because of age or medical conditions could be harmed by other people who don't get vaccinated by, getting infected with the disease by them. And similarly for people who who are immunocompromised. And so this is often seen as, well, if there's a harm to third parties, therefore the harm principle would justify the government to intervene. But really that's a little too quick, because you have to keep in mind that the harm principle states a necessary, not sufficient condition for government restriction on liberty. It says that the state should only restrict freedom to prevent harm to others, not that it should always restrict freedom whenever there's some harm to a third party. So there could be some harms to third parties that are so minor and small that it isn't appropriate for the government to intervene to do something about them. And a parallel example would be, you should only go to the hospital when you're sick does not mean you should always go to the hospital when you're sick. If you have a minor cold that's going to resolve in a couple of days, there's probably no need for you to go to the hospital. So an application of the harm principle to vaccine mandates would need to consider the extent of harm caused by vaccine hesitancy, as well as harms that could result from the mandate itself. And you'd need to have some sense, is the harm and the intervention, is this intervention, is it proportional to this harm, right? So you wouldn't want to have an intervention where the harm caused by the mandate itself is greater than this harm you're trying to prevent. Another idea that often comes up in connection with the ethics of vaccine mandates in a very general way is free riding. Free riding is a concept from economics, and it refers to enjoying the benefits of a public good while not sharing in the cost of maintaining it. In the case of vaccination, the public good is like herd immunity, less spread of disease. And the idea is that someone who doesn't get vaccinated, but just sort of expects other people to get vaccinated and therefore sort of to be protected by the vaccination of others, is sort of free riding in a similar way as someone who enjoys the benefits paid for by taxes like roads, social services, etc., but who doesn't pay taxes themselves is free riding. And so one thought here is that free riding is sort of immoral. And one way to think about why free riding might be immoral is the categorical imperative, which, when we think of the first form, states that you should act only according to that maxim, you can will become a universal law. This seems to suggest that unless you've got a good medical reason not to be vaccinated, just free riding, being a vaccine free rider is kind of immoral, because essentially you're thinking, well, I want everyone else to get vaccinated, and that way I don't have to get vaccinated. I don't have to have that little sore spot in my arm for a couple of days or something, and that will save me that trouble. So I won't get vaccinated, and I'll just expect other people to do it. But of course, if everyone is going to reason in this way, then nobody gets vaccinated, and that's going to be very bad. And so the idea here is that this would be a reason to think that the vaccine free riding is immoral for people who don't have a good medical reason to not be vaccinated. However, even if this argument is right, even if vaccine free riding is immoral, it doesn't follow that the government should make vaccination mandatory, nor does it specify how they should do it. And that's because there's a difference between morality and ethics and what's legal. So if you're asking what's a good policy, that's different from what is immoral. So it might be, for example, immoral to lie to your friend about some personal matter, but you probably don't want the government interfering with your personal relationships with your friends and other people. So what's ethical and what's legal aren't the same thing. And if you're thinking about a policy about a vaccine mandate, that is getting into the realm of what's legal or not. So to wrap up, the points I'd like you to take away from this lecture is that across the board arguments for vaccine mandates do raise important ethical issues and concepts that are relevant to vaccine mandates, but they tend to be inconclusive. And that's because as Navin and Atwell point out, the details of vaccine mandates, the context in which those vaccine mandates are implemented really make a huge difference to whether the vaccine mandate itself is justified or not. And so that's something we're going to explore in further detail in the next lecture when we look at the example of vaccine passports during the COVID-19 pandemic. Okay, so I'll stop there and see you again soon. Bye-bye.